This is the audio lecture for the part of Chapter 4 lecture that we did not finish in class. Problems of the breast. Benign problems of the breast consist of fibrocystic changes, fibroadenoma, nipple discharge, mammary duct ectasia, and intraductal papilloma. Approximately 50% of women experience a breast problem at some point in their adult life. The most common benign breast problem is fibrocystic changes. Fibrocystic changes are characterized by lumpiness, with or without tenderness in both breasts. Single simple cysts can also occur. Symptoms usually develop approximately a week before menstruation begins and subside approximately a week after menstruation ends. Symptoms include dull, heavy pain and a sense of fullness and tenderness, often in the upper outer quadrants of the breast. The next most common benign neoplasm of the breast is fibroadenoma. It is the single most common type of tumor seen in the adolescent population, although it can also occur in women in their 30s. Fibroadenomas are discrete, usually solitary lumps averaging 2.5 centimeters in diameter. Occasionally, the woman with fibroadenoma experiences tenderness in the tumor during the menstrual cycle. Fibroadenomas do not increase in size in response to the menstrual cycles as cysts do. They increase in size during pregnancy and decrease in size as the woman ages. The cause of fibroadenomas is unknown. Nipple discharge is a common occurrence that concerns many women. Although most nipple discharge is physiologic, evaluate each woman who has this problem thoroughly, because a small percentage will be found to have a serious endocrine disorder or malignancy. Most discharge is elicited by the woman pressing on the breast or the nipple, or the breast or nipple being stimulated, and is usually not a concern unless the woman is postmenopausal or a mass is present in the breast. Mammary duct ectasia is an inflammation of the ducts behind the nipple. It occurs most often in perimenopausal women. In mammary duct ectasia, nipple discharge is thick, sticky, and colored white, brown, green, or purple. The woman frequently experiences a burning pain and itching or a palpable mass behind the nipple. Intraductal papilloma is a rare benign condition that develops within the terminal nipple ducts. The cause is unknown. It usually occurs in women between ages 30 and 50. The papilloma is usually too small to be palpated, and the characteristic sign is spontaneous unilateral nipple discharge that is serous, serosanguinous, or bloody. After eliminating the possibility of malignancy, the affected segments of the ducts and breasts are surgically excised. Cancer of the breast. The United States has one of the highest rates of carcinoma in the world. After skin cancer, breast cancer is the most diagnosed cancer and the leading cause of cancer deaths in women. 1 in 8 American women will develop breast cancer in their lifetime. No clear method for prevention has been formulated. The prognosis for and survival of the woman are improved with early detection. Therefore, women must be educated about risk factors, early detection, and screening. Although the exact cause of breast cancer is still unknown, researchers have identified certain factors that increases a woman's risk for developing a malignancy. In your textbook, box 4-5 lists these factors. However, the most important predictor for breast cancer is age. The risk increases as the woman ages. Chemotherapy prevention is the use of medications to reduce cancer risk. Tamoxifen and raloxifene block the effect of estrogen on breast tissue. Studies have shown that these two drugs can reduce the risk of breast cancer, and the FDA has approved them for such use. Screening and diagnosis. Breast cancer in its earliest form can be detected by a mammogram before it is felt by a woman. However, estimates indicate that women detect 90% of all breast lumps. Of this 90%, only 20 to 25% are malignant or cancerous. More than half of all lumps are discovered in the upper outer quadrant of the breast, which we call the tail of Spence. The most common presenting symptom is a lump or thickening of the breast. The lump may feel hard and fixed or soft and spongy. It may have well-defined or irregular borders. It may be fixed to the skin, thereby causing dimpling to occur. A nipple discharge that is bloody or clear also may be present. Early detection and diagnosis reduce the risk of mortality because cancer is found when it is smaller. Lesions are more localized, and the tendency is to have a lower percentage of positive lymph nodes. This is an image of a woman undergoing mammography. And this is ways that we diagnose. A is needle aspiration, and then B is open biopsy. Medical management of breast cancer. Controversy continues regarding the best treatment for breast cancer. Nodal involvement, tumor size, receptor status, and aggressiveness of the cancer are important variables for treatment selection. Medical management of breast cancer includes surgery, breast reconstruction, radiation therapy, adjuvant hormone therapy, biologic targeted therapy, and chemotherapy. Breast conserving surgery such as a lumpectomy or partial mastectomy. A total simple mastectomy is the removal of the breast containing the tumor. A modified radical mastectomy is the removal of the breast tissue, skin, and fascia of the pectoralis muscle and dissection of the axillary nodes. A radical mastectomy, although it is rarely formed, is the removal of the breast and underlying pectoralis muscle and complete axillary node dissection. After surgery, follow-up treatment may include radiation, chemotherapy, or hormone therapy. Breast reconstruction. The goals of surgical breast reconstruction are achievement of symmetry and preservation of body image. Surgical reconstruction can be done immediately after removal of part of the breast or at a later date. This slide shows different surgical alternatives for women with breast cancer. A is a lumpectomy, where they just take out the lump that they find and some of the surrounding tissue. B, a partial mastectomy. C, total simple mastectomy. And D, radical mastectomy. Question. The CDC recommended medication for the treatment of chlamydia would be A, doxycycline, B, podophylox, C, acyclovir, or D, penicillin. This question goes along with our earlier topic in class on STIs. If you chose answer A, you are correct. Doxycycline is effective for treating chlamydia, but it should be avoided if the woman is pregnant. Podophylox is a recommended treatment for non-pregnant women diagnosed with human papillomavirus infection. Acyclovir is recommended for genital herpes simplex virus infection. And penicillin is not a CDC recommended medication for chlamydia. It is the preferred medication for syphilis. This ends this discussion on matters of the breast for Chapter 4. Thank you.